A transesophageal echocardiogram machine is a specialized form of echocardiography in which an ultrasound transducer is inserted into the esophagus to obtain high-resolution images of the heart. The TEE probe emits high-frequency sound waves that bounce off the heart and produce live images displayed on a monitor. The TEE probe passes through several anatomical regions during insertion, including the oral cavity, oropharynx, larynx, esophagus, and stomach. Possible complications include dental and lip trauma, laceration and perforation, airway compression or vocal cord trauma, and bleeding. The TE probe includes a distal tip with a transducer lens, a flexible shaft, and a control housing for maneuverability. It features control strain relief and is connected by a cable to a larger system. The schematic highlights how ergonomic and precise design is necessary to allow manipulation within the esophagus. The Philips system is a modern and miniaturized 3D echocardiography solution used primarily in intraoperative or interventional settings. It provides real-time, high-resolution 3D images of the heart and supports decision-making in cardiac surgeries. The probe emits ultrasound waves through the esophageal wall toward the heart, with sound waves reflecting back to the transducer to create real-time images. Mechanical functions include advancement, withdrawal, turning left-right, and rotating from 0 to 180 degrees. Flexing capabilities include anti-flexion, retroflexion, and lateral bending. Midazolam, a benzodiazepine, is used for sedation, anxiolysis, and amnesia during TEE. It is typically administered IV at 1 to 5 milligrams, with onset in 1 to 5 minutes and effects lasting 30 to 60 minutes. Lidocaine is a local anesthetic used to numb the oropharynx and suppress the gag reflex before probe insertion. It is commonly applied as a gel or spray and ensures patient comfort and safe passage of the TEE probe into the esophagus. Fentanyl is used for pain relief and mild sedation. A typical dose ranges from 25 to 100 micrograms, with onset in 2 to 3 minutes and a duration of 30 to 60 minutes. It complements midazolam to achieve balanced sedation and analgesia. Key components of the TE probe include a 3 to 8 MHz phased array transducer with 64 or 128 piezoelectric elements, yielding high-resolution images within a 90 to 120 sector angle. The multilayer composite lens ensures efficient wave transmission. Tip diameter is 10 to 15 millimeters, with a length of 20 to 40 millimeters. Materials used are medical-grade, biocompatible polymer and metal. The microarchitecture includes a gastroscopic tube with 200 coaxial cables, connecting to a PZT matrix with RX and TX elements. A 3x3 subarray configuration enables electronic focusing and steering. The cross-section reveals layers of ground foil, matching layer, conductive glue, and ASIC bond pads, spaced with 150 micrometers dicing kerfs for electrical isolation. The purpose of ECG in this context is R-wave gating and synchronization of images. It operates with a frequency range of 0.05 to 150 Hz and a sampling rate of 500 to 1000 Hz, ensuring accurate cardiac event capture. The 12-lead ECG system includes 4 limb electrodes and 6 precordial leads to provide full cardiac electrical mapping. After each use, the probe should be rinsed with enzymatic detergent and disinfected using glutaraldehyde or OPA. It must be inspected daily for cracks or electrical issues. Store in a dry ventilated cabinet, avoiding tight coils or compression to preserve its integrity.